Friday's kind of turning into our male-centric topic on the channel, which I'm totally fine with. It happened by accident, but I keep finding these little studies and little stories that are out there, so maybe I'll continue on with this trend. And especially right here, we have a declining testosterone levels in men. And yeah, you can tell that. You didn't even need any scientific studies to figure out that T levels are dropping literally everywhere, okay? Just take a wander around any supermarket, okay, Walmart, just you're anywhere where men are likely to show up, and you're just going to notice that, yeah, there's a lot of the slight shoulders and slumped and just hunched over postures, and a bunch of guys just carrying the purse for their wife because they're texting their boyfriend. It's not a good look out there, okay? So why is this happening? Mostly has to do with diet. I'll just go ahead and cut to the chase. Anyways, testosterone levels in men are declining at an alarming rate. Most men between age 25 to 50 who are tested in my office, this is Allison, who have levels around 300 nanogram per deciliter or lower, and they should feel their best around 800. Wow, so less than half. That makes sense. That's why there's so many male feminists out there. Low testosterone levels in men range of symptoms and weaken their long-term health. This hormone is powerful, yes it is, and necessary for a variety of biological processes. It is associated with improved energy, cognitive function, healthy muscle mass, healthy sexual function, and even improved cardiovascular health. In a report published by Nature in 2018, men with low testosterone levels were more than likely to vote Biden. To have multiple chronic health conditions, poor cardiovascular outcomes also increase as testosterone levels decline. Testosterone deficiency has been implicated in coronary artery disease, congestive heart failure, imbalanced cholesterol levels, diabetes, and increased cardiovascular mortality. Do those sound like good reasons to make sure your levels are high enough? Exactly. Testosterone replacement therapy, described by doctors, is one of the fastest way to boost your levels. Yeah, exactly. Go in every once in a while and get a shot in your rump, and you can just go ahead and start feeling like a real man again. It is available via injections, pellets, implanted under the skin, oral capsules, ladies, and even topical creams. While testosterone therapy can be exceptionally beneficial and is often well tolerated, some risks include blood viscosity if over-medicated. Yeah, but if you're going to like a medical healthcare professional and not Pedro in the back of a van offering, hey, I'll shoot you up, I'll get some tea for you, it shouldn't be a problem. And then also proper hydration if your blood's getting too thick. Geez, unless you're like Keith Richards and you go to Switzerland and get it changed out every 3 months, you shouldn't be running into that problem. Drop the motor weight, brother. This is why blood tests every 3 months to boost both hormone and red blood cells are advised. Yes, indeed. It is also important for men to get their prostate-specific antigen, PSA, a different type of PSA. All right. Tested regularly to rule out prostate cancer, as hormonal therapies, both testosterone and DHEA discussed below, can increase risks. Some patients try other methods to naturally boost their levels and support their body as a whole to improve their hormonal production and balance. Yeah, outside of just getting on the straight and narrow when it comes to sleep patterns, diet, and exercise, there's very little you can do to naturally boost your testosterone levels. There are those goofy little over-the-counter supplements that say that, it's going to go ahead and boost your testosterone level. Like there's those weird Chinese herbs, ZMA. What are the other ones that are there's one test booster that's out there on the market that's just hot garbage. There's very little evidence that any of that stuff actually works outside of like placebo effects that may or may not be happening. But what are some symptoms of low testosterone? It's pretty noticeable, especially if you're a man, if you're not feeling 100% like a man. But symptoms of low T: fatigue, reduced stress tolerance, impotence, infertility, decreased muscle mass, increased body fat, difficulty losing weight, low or absent sex drive, decline in memory and overall cognition, changeable mood, new onset anxiety or depression, insomnia, sleep disturbances. Are you becoming a woman? Exercise boosts testosterone. Yes, indeed. Like I was saying before, there's few things you can do to maintain or rather reinvigorate your natural production of testosterone. Exercise is one of the best ways to improve the body's natural production of testosterone. Research has shown the benefits of both aerobic, such as swimming, biking, running, anything that requires production and use of oxygen within your body. Okay, not that your body produces oxygen, but it needs it in order to maintain doing the activity. Okay, there's different types of zones that your body go through in order to perform specific tasks, right? But we don't need to get into that, okay? Just aerobic activity, so cardiovascular activity, and weight training. In one study published in the World Journal of Men's Health in 2018, men with testosterone deficiencies and erectile dysfunction had statistically significant improvement with a cycling exercise. Oh, exactly. Weight training delivers benefits over time by increasing the body's production of growth hormone. Yeah, because you're going to have more muscle mass. By that logic, you're just going to have more hormones as well because you're a bigger human being, as well as testosterone. Building lean muscle mass improves weight loss efforts as fat tissue has aromatase enzymes that convert testosterone to estrogen. This, of course, worsens testosterone deficiencies and has negative effects for both men and women. Losing weight and increasing muscle mass compounds the benefits. Yes, indeed. DHEA supplementation. I'm not pronouncing that. Yeah, I'm not. Screw that. Is a precursor hormone that can be used by the body to make testosterone. Supplementing with DHEA is essentially giving the body more building blocks to create its own testosterone. Yes, replacing any deficiencies that may happen. While this is not deemed natural by some, it does offer patients a level of flexibility in raising their levels without committing to regular injections and frequent blood tests. DHEA supplementation has numerous benefits for both men and women. It's been well studied in the elderly, and maintaining adequate levels has shown to reduce cognitive decline. Furthermore, DHEA supplementation has been shown to increase free testosterone levels in young men with testosterone deficiencies. Herbal supplement. There it is, Tribulus teteritus. Yes, that's the one that's like, oh no, it's definitely a natural T booster. No, it's not. It's stupid. One of the many herbs that can optimize hormone production. Two common effects are ones of Tribulus and saw palmetto. Oh my god, witchcraft, absolute witchcraft. Tribulus, which has been known as goat's head or puncture vines. Yes, exactly. Just sit around in a circle and draw on your hand, and it's like, oh yeah, you'll feel like more of a man. Whatever. It also increases the enzyme 5-alpha reductase, which helps the body convert testosterone to a more active form, DHT, as opposed to DHEA, which is apparently supposed to increase DHEA. Sure it does. Barely any studies to actually prove that. This herb has long been used for impotence, decreased sexual drive, fatigue, and improved fertility. Yeah, exactly. It's been used, yeah, for a long time, and so are crystals for healing. Saw palmetto is more widely studied regarding the effects of reducing prostate cell growth in men for benign prostatic hyperplasia. However, some research shows that it helps increase androgen levels and improve protease function. Yeah, I have no first-hand knowledge or any say about saw palmetto. All I know is it's been around for a minute. It's been used by herbalists to treat impotence, low libido, and testicular atrophy. All right, well, if it works, then go for it. Most labs offer hormone panels readily accessible to self-order and can be reviewed with your healthcare provider. The effects of low testosterone should not be discounted by you or your doctor. Maintaining optimal levels at all ages will help promote more vibrant and resilient health. Yes, exactly, and we are running a severe deficit of strong, healthy men. Don't find yourself among those ranks. Resist the slave mind, my friends. With all of that said, thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.